So welcome everyone. This webinar is sponsored by Merrick Health and Legacy. So a little bit about what we do here at Legacy. Legacy is a sperm testing and freezing company. We offer at-home semen sample collection for semen analysis, DNA fragmentation testing, sperm cryopreservation, as well as STI testing, and even virtual fertility consultations. Now, we are not testosterone replacement therapy providers. We don't prescribe TRT or any other medications, but we do partner with providers like Merrick Health to ensure that their clients have the ability to test and preserve their fertility. Our clinical team is made up of experts in the men's health space who also deeply understand the impacts of low T and TRT on fertility specifically. Now, Legacy is America's #1 digital fertility clinic for men that allows you to test and freeze your sperm from home. We test and freeze more sperm than any other lab or hospital in the country. So to date, we've got over 30,000 semen analysis tests performed. Over 20,000 sperm samples have been frozen with us. We're also a trusted provider for the U.S. Navy SEALs, the U.S. Green Berets, and the Department of Veterans Affairs. Now, in the way of quick introduction, my name is Stephanie Saborin. I am the Director of Clinical Services here at Legacy. My professional background is in urology surgery, where I subspecialized in men's health. I've been working in this space for the past 10 years. I'm also certified in andrology, which is the science of sperm, and men's health. Now, in my career before coming to Legacy, I helped patients to manage their testosterone therapy, erectile dysfunction, and prostate issues, as well as infertility. Now I see patients who are preserving fertility prior to TRT or trying to conceive after being on TRT for a while. So we've got a lot to cover here. And I just want to make a quick note before we dive deep into this, that people take testosterone for a variety of reasons. The audience I'm speaking to tonight is solely cisgendered men, so not gender affirmation clients who might be taking testosterone as a part of their gender transition. This talk is going to be looking specifically at the impacts of testosterone on sperm production and male health overall. So let's get started with some basics. So what is testosterone and how exactly does it work in your body? So this can be a pretty complicated process, which I will try to explain as clearly and easily as possible. So testosterone, what it is a sex hormone. Hormones are the body's chemical messengers. So they travel from one organ or another place in the body, usually through the bloodstream, and they affect many different bodily processes. Now, testosterone is the major sex hormone in males. It is essential for the development of male growth and masculine characteristics. So testosterone plays many important roles within the body, such as the development of the penis and testes, the deepening of the voice during puberty, appearance of facial and pubic hair at the start of puberty, and then later in life, it also contributes to male balding. It also plays a part in muscle size and strength, bone growth and strength, sex drive, libido, and of course, sperm production as well. Now, this is more than just testosterone. So the feedback loop that I'm about to explain is very complicated. It does involve other hormones as well. So things such as GnRH, FSH, and LH, which are all necessary in the production and release of testosterone, as well as in sperm production. Now, signals that are sent from the brain to the pituitary gland, which sits at the base of the brain, control the production of testosterone in men. The pituitary gland then relays signals to the testes, telling them to produce testosterone. Now, what we call this feedback loop here, this closely regulates the amount of hormones that are in the blood. So when testosterone levels rise too high, the brain sends a signal to the pituitary to either reduce or completely stop production of these hormones. So rising levels of testosterone act upon the hypothalamus in the brain and the pituitary to stop the release of GnRH, FSH, and LH. So this system works to help to balance the testosterone in the blood at a steady and constant level in men after puberty. Now, if your testosterone levels become elevated above their normal levels, which we call the set point levels, then the testosterone is going to prevent the hypothalamus from secreting as much GnRH. So this will in turn cause lower levels of FSH and lower levels of LH to be produced. Now, lower LH levels will lower the amount of stimulation that cells in the testes receive, and in turn, that's going to lower the production of testosterone. Now, because FSH, LH, and GnRH are also involved in the production of sperm, decreasing levels will subsequently also decrease sperm production. I know that was a lot. We'll refer back to this later. But let's talk about low testosterone. So, this issue is fairly common nowadays. So, what's considered normal when it comes to testosterone? Normal testosterone levels in men, generally speaking, range anywhere from 300 to 1,000 in general. Now, different labs are going to use slightly different reference ranges for what is deemed normal versus abnormal. Age specific testosterone average levels, according to a 2022 study, are shown here on this slide. And as you can see, ranges change slightly based on age and known declines that come with the aging process. So the next natural question here is, does this happen all at once, like menopause? Is it at a particular age, or does this happen over time? The answer to that is that as men age, testosterone levels drop very gradually. So, in an average, about 1 to 2% each year. Now, unlike the relatively rapid drop in estrogen that causes menopause in women, this is slightly different. So, the testes produce less testosterone. There's going to be fewer signals from the pituitary telling the testes to make testosterone. Also, as men get older, their livers make more sex hormone binding globulin, which binds to testosterone that is circulating in the bloodstream already. Now, all of this together reduces the active or free form of testosterone in the body. More than a third of men over the age of 45 may have reduced levels of testosterone uh, compared to what would be considered normal. Although defining optimal levels of testosterone is a really difficult thing to do and somewhat controversial depending on who you speak to. Some factors contributing to low testosterone in men are going to be things like age, obesity, and metabolic disorders, such as things like diabetes or genetic disorders like Klinefelter syndrome, just being one example. Disorders of the pituitary, hypothalamus, or thyroid gland, testicular injury or testicular failure. And when I say injury, I don't mean that soccer ball hit you took in the third grade. I'm talking about a serious injury, something that would have led you to seek medical treatment in a hospital. Also, certain prescription medications, chemotherapy or radiation treatment, and even excessive alcohol consumption or marijuana usage. Testosterone levels nationally have been steadily decreasing more than 1% per year since the 1980s. Now, this is in addition to the normal decreases that we see with the aging process as well. Globally, fertility rates have halved in the past 70 years, leaving us 50% less fertile than our grandfathers were. Now, this is due in part to endocrine disrupting chemicals that we're exposed to in our everyday lives, as well as the epigenetic effects that come from them. So, in addition to those, lifestyle factors also play a part in this as well. Now, some symptoms of testosterone deficiency in adult men are going to include things like reduced body hair or facial hair, loss of muscle mass or tone, low libido, impotence, smaller testicles, even reduced sperm counts and infertility. Also, increased breast size or something called gynecomastia, hot flashes, irritability, poor concentration, depression, overall loss of body hair, brittle bones, and an increased risk of bone fracture. Now, just because somebody has a testosterone deficiency does not mean that they will experience any one of these or all of these. These are just some very common side effects of that.
Blood work is of critical importance if you want to understand what's going on with your body, whether that be preventing disease, optimizing performance. Getting blood work done is incredibly important on at least a biannual basis, in my opinion, is what I do personally. Understandably so, knowing what to order and how to interpret it is beyond overwhelming. It's incredibly nuanced to interpret blood work with the level of rigor that is needed to actually assess the root cause of many underlying issues and or hit the perfect balance of optimization. And that's where Merrick Health comes in, with highly educated coaches and medical providers who are always staying on the cutting edge, always on top of the most recent literature to give the most rigorous interpretation of your current health status, interpret if there's any ways to optimize your lifestyle, supplementation, sleep hygiene, diet, pharmacology. It's all taken into account here at Merrick Health. So if you want to take control of your health and or optimize your performance, check us out, merrickhealth.com.
So, if someone wants to increase their testosterone levels and relieve some of these symptoms, they might be prescribed medication like TRT. So, TRT is testosterone replacement therapy. That is the medical therapy of introducing exogenous testosterone into the body. Now, there's two primary reasons for taking TRT. Like I said before, there's many reasons, but two primary. The first one is going to be a testosterone deficiency, or what we would consider clinically low testosterone. This is also referred to as hypogonadism. The other is for purposes of vitality or longevity or athletic performance. Now, it's really important to remember that both of these reasons have very differing impacts on fertility, and they need to be managed quite differently medically. In either case, it's important to take steps to preserve your fertility prior to starting on a TRT journey, because the one thing that we can guarantee across the board is that TRT will impact your sperm parameters regardless of the underlying reasons that you're choosing to take it for. Now, there are different medications that are used to increase testosterone. There is TRT, which comes in various forms, such as transdermal patches or gels, injectable testosterone, pellets that are implanted under the skin that slow release over a period of months. We also have alternative options of what we would consider to be fertility safe ways of increasing testosterone. And that can be with the use of medications such as Clomid, which comes in a pill form, or something called HCG, which is an injectable medication. Now, many people with low testosterone may want children either now or in the future. So let's dive into how testosterone therapy affects your sperm and future fertility. So, to understand the impacts of TRT on fertility, first you need to understand what your sperm parameters are in the first place. So we'll start off with concentration or count. So this is the count, actual count of how many sperm we see in any given sample. Also, another term you may hear is something called DNA fragmentation. Sperm DNA fragmentation analysis is an advanced male fertility test that measures the percentage of abnormal or damaged strands of DNA that are carried by sperm. Now, higher levels of sperm DNA fragmentation might contribute to infertility, recurring miscarriages, or even poor health outcomes for your future children. You'll also hear the term morphology. Morphology refers specifically to size and shape of sperm alone. This is the piece that I refer to as sort of the grayest of all gray area in fertility. It is the one parameter that is least understood by the science community as a whole, as far as how much, if any, impact it may have on conception at all. Also, the term motility, you'll hear this a lot when we're talking about sperm. Motility tells us how the sperm themselves are swimming and moving. Good motility is key and necessary for natural conception, as well as certain forms of assistive reproduction. And lastly, I'll talk about volume. Volume is the amount of ejaculate that's being measured. Now, sperm are just a very small component of the ejaculate, which is predominantly made up of seminal fluid. The term azospermia is defined as a complete absence of sperm from the fluid that's ejaculated during orgasm, so semen. Research shows us that most people on TRT are likely to become azospermic after only 4 to 6 months of use. Clinical research around testosterone usage and sperm parameters is pretty highly varied, with one clear overarching constant, and that is the fact that taking testosterone is guaranteed to have a negative impact on your future fertility and your sperm production in some way. So, why is this happening? Now, this goes back to that feedback loop that I spoke about a little bit earlier. So, increasing the level of testosterone in the bloodstream by adding it in artificially lowers the hormones FSH and LH, which control sperm production. So, basically speaking, this is a really carefully calibrated system. And by adding in extra testosterone, it simply throws that system off balance. So, how long does it take for testosterone to impact your sperm production? Well, the reality is that nobody knows the answer to this for sure, but it likely starts impacting production immediately. The effects of that have been seen in research in as little as only 10 weeks. I think what People often mean when they ask this question really is just how long am I going to have, how long am I going to have sperm at all, really, after starting TRT? And the truth to that is that nobody can answer that question either. There are so many factors affecting it, including your baseline sperm count, dosages of medications, etc. So, really, the safest bet is to assume that your fertility is going to be permanently impacted and plan accordingly by freezing a sample as a backup. Now, another question I get quite often is, can you recover sperm production after pausing testosterone? The answer on this one is tough as well. That answer is possibly with kind of a big question mark there at the end. So, timeline and possibility for recovery depends on a lot of different factors. How long you've been on testosterone in the first place, your dosing, your age, as well as what your baseline sperm parameters were prior to starting on testosterone. Generally speaking, you'd need to be off of it for anywhere from 6 months to upwards of 2 years in some cases before you'll even have an answer to that question. Now, recovering your fertility after testosterone therapy, unfortunately, is never guaranteed. So, in one study, 30% of men were not able to restore a normal sperm count after 12 months off of testosterone. There are dozens more studies just like this one. So let's talk about other effects of testosterone therapy besides just on your sperm counts. So, taking exogenous testosterone can stop your body from making its own. This goes back again to that feedback loop we were talking about earlier. So, when your body recognizes that there is enough or even too much testosterone, your brain is going to signal the testes to stop producing it. Your body has no way of identifying how the testosterone got there, only that there's enough and it should not make any more. The testosterone will prevent the secreting of as much GnRH. This is then in turn going to cause lower levels of LH to be produced. Lower LH lowers the production of testosterone. So, too much testosterone. Well, having too much naturally occurring testosterone is not a common problem among men. Many people supplementing testosterone end up with levels on the upper end of normal or even above normal limits. Now, it can be difficult defining what normal testosterone levels actually are. So, blood levels of testosterone vary pretty dramatically over time and even during the course of any given day. Most of what we know about abnormally high testosterone levels in men comes from athletes who are using testosterone, steroids, or other hormones to increase their muscle mass and athletic performance. Some problems associated with artificially high testosterone levels in men include things like low sperm counts, the shrinking of the testes, impotence, which can seem kind of odd, right? Most people mistakenly believe that more testosterone equates to being more fertile or more virile, which is completely false. Heart muscle damage, an increased risk of heart attack, prostate enlargement with difficulty urinating, as well as an increased prostate cancer risk. Also, risks for liver disease, acne, fluid retention with swelling of the legs and feet, weight gain, which perhaps is related in part to the increased appetite that comes with these high testosterone levels, and high blood pressure and cholesterol. Other impacts are going to be things like insomnia, headaches, increased muscle mass, which is usually what people are shooting for when they're doing these things, increased risk of blood clots, though, stunted growth if taken in adolescence, and also uncharacteristically aggressive behavior. Although this is not well studied or clearly proven, but they have determined that mood swings, euphoria, irritability, impaired judgment, and even delusions are commonly present with this. It's really important to speak with your doctor about all of the potential risks associated with TRT to determine your personal risk factors and if it's right for you individually. Now, if someone hasn't started TRT yet, but they're planning on it, what can they do to protect their fertility? The best way to do this is to preserve your fertility before starting on TRT. And this is by freezing a sperm sample. This will be the determining factor for some people as to whether or not they can ever have biological children in the future. That's really impactful. Freezing sperm ensures that if you are unable to maintain sperm production or to recover your sperm production after coming off of TRT, that would be sufficient for natural conception, that you can still have the ability to have biological children via assistive reproductive procedures like IUI or IVF, for example. So, freezing sperm, let's talk about how it works with legacy. So, first, you can go online and order a test kit. Your sample is going to be produced via masturbation and collected in the privacy and comfort of your own home. Included in the test kit is going to be a prepaid FedEx shipping label. So once your sample is produced, you simply attach that prepaid label to the box, schedule pickup right from your doorstep, or you can drop off at any FedEx location that might be convenient to you. Your sample is then sent overnight to our lab, where it is tested the next morning and then frozen immediately after testing. It is that simple. So, how does that compare to the traditional way of freezing sperm? Well, doing this with a traditional sperm bank or lab requires physician's orders, appointments that can take months to get, and an infinitely more awkward and uncomfortable experience when you need to produce the sample in that room in the office with the weird black leather couch, outdated and overused pornographic material. Absolutely nobody wants to do that. Frozen samples can be used in the future for procedures like IUI or IVF. The beauty of this is that samples never degrade over time, so they can be used at any point in the future. So let's say hypothetically you froze your sperm at age 25. Well, let's say at age 40 you're ready to use it. It would be as if 25-year-old you conceived that child born of that sperm. It's really quite amazing. Now, we can't talk about TRT and overall sperm health without also touching upon some lifestyle and environmental factors that also do negatively impact sperm. So, for anyone who might be interested in conceiving either now or in the future, there are a few important things that you need to avoid in the months leading up to trying to conceive. First one is going to be certain supplements. These are specific supplements that either contain testosterone or that claim that they have testosterone boosting agents or ability. Also, you're going to want to avoid exposures to high temperatures. This is going to be things like hot tubs, steam rooms, saunas, hot yoga, depending on the time of year, also heated seats in your car. You also want to avoid saddle sports or anything that has you seated in a straddled position. So, this is going to be things like bicycles, pelotons, horseback riding, or even motorcycles. And then those ice baths or cold plunge pools that everybody's buying out all of the chest freezers to make at home. Unfortunately, just like those high heat things will shock your system and impact your fertility negatively, so will those ice cold drops in temperature. So, you're going to want to avoid those. And lastly, compressive undergarments or clothing. So this is going to be things like briefs, boxer briefs, compression shorts, bike shorts, running tights, or leggings. Now, I am at the home stretch here, I promise. So thank you for hanging in there with me. Lastly, we're going to talk about trying to conceive after starting on TRT. So, what if you've already been on TRT for either a few weeks or a few years, and you decide you want to have kids now? So, what can you do to understand the impacts that may have happened on your fertility and improve your chances of getting someone pregnant? So, for starters, you need to know your numbers. You really should know what your lab values are, and you should always be monitoring testosterone levels while you are on TRT. But you should also have a semen analysis test done to determine what your sperm parameters are as well. In a perfect world, you would have frozen a sperm sample prior to initiating TRT, but if not, you can still freeze a sample after the fact if you are still producing sperm. Now, if you plan on conceiving naturally, it's important to continually monitor your sperm parameters by testing at regular intervals while on TRT. It is really impossible, unfortunately, to predict at what point parameters will either drop or when sperm production will just simply cease or halt. You can never assume that if you test one time and you have sperm, that you will always have it, because that is simply not the case. You should really think about possibly speaking with a fertility specialist if you're unsure of what your sperm parameters are or of what that means for you and your future fertility. You can always talk to an expert that can help you better understand this as well as what your options may be in the future. Now, The process for testing only without freezing your sperm is exactly the same as if you're freezing. So you're still ordering that kit, you're producing that sample at home, you're overnighting it to the lab. Once the results are received within 24 to 48 hours, you can always choose to add on freezing or storage after the fact, but you're not required to store samples that are tested. And again, infinitely less awkward than the traditional way of doing a semen analysis test. So what if you have you've done this test now and you have poor parameters? Well, first, you should think about working with your prescriber to either pause TRT for a period of time or work with talking to your doctor about possibly starting on or continuing on some supportive medications, such as Clomid or HCG, like I mentioned earlier. Now, you should be monitoring semen analysis tests to see if sperm production has resumed or if it has improved with these changes. You should never make these changes on your own, though. Always consult with your prescribing doctor first. So, if we're at that point where you're thinking it might be time for you to do a test, let's talk about some ways that you can do this and ways we can make it affordable for you. For starters, Merrick clients get 20% off of all products and services with Legacy by using the code Merrick20. Now, over 500 employers actually cover our services as their preferred sperm preservation solution. We are contracted with all of the fertility benefits providers on the market. So, this includes companies like Carrot, Progeny, Maven, Stork Club, Win Fertility. Many people will even have these coverages through their employer and not even know it. So I would say that if you're unsure or if you haven't heard these names, it's not a bad idea to check with your HR department to see if these are coverages you might actually have. These are separate from your health insurance plan. As part of our mission at Legacy to make our services more accessible, more affordable, we also offer financing options through either Split It or Affirm as well. One of them is interest free, the other is with interest. I'm sure you have seen these logos. If you're an internet online shopper like myself, I see these pop up everywhere I shop. They really can help to make it easy to find a monthly payment amount that works with absolutely any budget. Also, Legacy is HSA and FSA eligible, so you can use those tax-free benefits cards you might have to pay for these services as well. So I want to thank you all so much for taking the time to attend this session, talking about TRT and fertility. Hopefully this information was informative and helpful for your future fertility planning so that you're able to protect your legacy. And feel free to screenshot this slide, which shares the Legacy Merrick landing page. This landing page with our partnership also auto applies that 20% discount to any orders that are going through if you access it through that link. If you're not accessing through that link, Merrick20 is the discount code if you're just typing it in. And that's how you get that 20% off.
Stephanie, thank you so much. And I just want to add a thanks to everyone in the audience, everyone attending. There wasn't at all a drop off with any of the technical issues up front. So I really appreciate all you guys' patience with us. Do you have time for a few questions?
I do. And I'm really sorry for all that. I think half the tech issues may have been on my end, and I am so sorry for that. But yes, I will happily field any questions that either came up in the chat, or if people have questions that they want to start popping in, feel free to add them now. More than happy.
Phenomenal. First one from anonymous attendee. What biomarkers should be optimized outside of sperm health for conception?
Can you ask them to elaborate on that? What are they asking? Are they asking about specific, what hormones should they be addressing, or?
My guess is just general health, any other levers that they could pull beyond just measuring and testing sperm motility and morphology like you discussed. If there's any other peripheral biomarkers, whether that's maybe fasting insulin, A1C, HSCRP for inflammatory status. Do you see, or do you guys see any of those other markers having an impact on just overall conception, health, success of conception, etc.?
Yeah, if you go down the rabbit hole of reading research studies, you can find studies that sway in many different directions when it comes to things necessary that you should be looking for conception. I would say overall, keeping it really general, remembering that honestly, a lot of lifestyle plays a bigger part than some of these other things. So things like your sleep, making sure you're getting a solid 8 hours a night of sleep makes a huge difference. Eating a normal, healthy, well-balanced diet. Also, a funny thing that, there isn't enough clear clinical research on this yet, but I have seen in practice a huge swing of people having fertility challenges being people who practice intermittent fasting. So I've told many people when working up fertility challenges to pause intermittent fasting. There's great health benefits. It works really well for maintaining, a healthy weight or for losing weight for those who need to do that. The problem is it works by impacting cortisol levels and hormones, and fertility is such a hormone driven process that I think sometimes things just get a bit out of whack while practicing intermittent fasting. So I would tell people to avoid that if they can for the period of trying to conceive. You don't have to avoid it forever. Um, and then all those other lifestyle things, you can still consume alcohol, but everything in moderation, keeping it, typically that the magic number is less than 7 drinks containing alcohol per week. Anything above that, and the higher they go, the more research shows that sperm parameters really start to tank out. Overall, other health, I would say, talk to your doctor, have your labs drawn, make sure you're getting a yearly physical and staying on top of overall health to hone in on any other issues you might need to be focusing on.
Phenomenal. This is a question for me. Sorry to cut the line, so to speak, but
It's all good.
you mentioned the cold therapy having some negative impacts on sperm parameters. I know I've read literature on, I believe it's called transient scrotal hypothermia with like laptops actually on the lap or sauna, hot tub.
Mhm.
But I've seen in kind of the biohacking community, there's a little kind of niche of individuals that are doing testicular icing with the idea that it would have mechanistically kind of the inverse effect and actually improve testosterone production. I'm curious if you could just speak to that. I know we get asked about it quite a bit. I haven't read any
Yeah.
literature that would show efficacy there, but curious what your thoughts are and what have you.
It's something that I am asked often and talk about often. Yes, so they sell undergarments that have inserts for ice packs. Save your money; they don't work. So you can't just ice pack or chiller ice to sort of combat those effects. It's all sort of it's an unproven thing. So and that would apply to icing, to the special underwear that they sell at a pretty high price tag. None of it's worth it. So the reason that all of these, so I always tell everyone, so your testicles, they are on the outside of your body for a reason. That reason is that they like to be about 3.5 degrees cooler than your internal organs do. So every guy knows what happens if you were to go and jump in and do a polar plunge, it's freezing cold. What's going to happen? Well, your testicles are immediately going to go, uh-oh, and pull up close and tight to your body. That is their self-warming mechanism. Um, the same can be said if you're crazy and you want to go jogging in Arizona right now in July. It's going to be pretty hot. What's going to happen? Your testicles are going to hang looser and lower from your body. That's their self-cooling mechanism. So your body has a really great ability of adjusting to maintain that 3.5 degree cooler temp than your internal organs do. Now, what happens when you do anything, whether it be on the hot end or the cold end, right? You do something that sort of inhibits your body from doing its own thing for self-heating and cooling. That's where your sperm production is impacted. So, like someone sitting in a hot sauna, your testicles can't get far enough away from your body to cool down because the room temperature is too hot. Same thing if you jump into that ice cold plunge in a cold cryo pool or something like that, your testicles cannot pull up any closer than they can get. They can only get warmed up to a certain point. So you're still inhibiting that. And that's the reason why neither of those works. Same can be said for icing. The damage has been done if you've heated it. So throwing an ice pack on later doesn't fix that. Great question, though.
Thank you for speaking to that. I was curious myself. I saw those.
Yeah.
I think they call them the snowballs or what have you for the undergarments. Question from anonymous attendee: is there any difference in sperm quality when freezing samples from young adulthood versus middle age? And is there an ideal age to freeze semen samples?
Yeah, great question. So there isn't a specific like age 25. There's not a particular number. Really, I mean, there's a young and healthy 25, and then there's a very unhealthy 25, so somebody who's going on drinking benders and using recreational drugs and all of these other things, just the fact that they're young does not help them in that case because of their lifestyle. So really, it boils down more so to lifestyle, but there are things that happen to your sperm over time based on age that you can't get away from. There are declines in motility that happen with the aging process. There's increases in that DNA fragmentation that happens with the aging process that you can't escape. So typically my recommendation would be you want to do this before age 40 if you can. It's still okay to do it after 40 if you're 42 and you're just getting around to it, that's fine too. But once you hit age 40, according to clinical studies, there's a much higher risk, 6 times higher risk actually, of having a child with a congenital condition, childhood cancers, schizophrenia, bipolar, autism spectrum disorder, and that's all from sperm. That's on the male side, not from the egg or the female side. So before age 40 would be ideal, but again, take lifestyle into consideration there too. So if you're one of those people who, is going on drinking benders every week and using drugs and doing all these other things, you might want to clean up your lifestyle regardless of your age before preserving your sample for the healthiest possible sample.
Another anonymous attendee asked, is conception through intercourse, does that improve the chance of having a successful pregnancy compared to IVF or IUI?
No. So, I mean, there's some fun benefits to conceiving through intercourse, but that's a whole nother conversation. But no, so success rates of, whether they be conceiving naturally, so to speak, via the good old fashioned way, or through things like IUI or IVF, success rates are varied. So basically in general, even talking about natural conception, you've got about a 25% chance of conceiving month over month. So that's where it stands. Now with IUI, it's a little bit lower. These are national averages. So of course this isn't exact for everybody, but IUI, it's a little bit lower. It's closer to 14% or so, 12 to 14% typically, chance of conceiving. And with IVF, actually higher chances. Typically the success rates with things like IVF are quite a bit higher. But with the caveat that you need to take into consideration the health of the woman carrying the child. So if it is a woman who's had previous uterine surgeries and has endometriosis and has PCOS, all these other problems, that sways things a bit. But if we're just talking about the average person who doesn't have a complex gynecologic history, then you're looking at success rates that are as high as 60 to 75% with IVF. So sometimes it's actually higher conception chances. So it's different for everyone why they would choose one method over another.
Do you have time for a few more?
Absolutely.
Cameron Batko asks, what underwear would you recommend? Are brands like Sheath or Duluth bullpen briefs with that testicular pocket? Is that a gimmick? Is there any established benefit to that little alcove?
They're gimmicks. They help to pull the testicles up off the body a little bit. So for workout purposes and things like that, if you're somebody who's hitting the gym a lot, I know I've got adult children, adult boys who I've had the conversation with about their compression shorts they like to wear when they're working out, that they're terrible for your fertility. And they laugh and say, well, good, we don't want to get anyone pregnant. So win-win. But typically for purposes of best sperm health and conception, loose fitting cotton boxers, or go commando, wear gym shorts, those types of things. Obviously, I do realize that if you're going to run a marathon, you're not going to do that in a pair of boxer shorts. I would say just limit the time you're wearing any sort of form-fitting undergarments or clothing to just that period of a workout. Don't wear them as your daily underwear, and then it's fine.
Another anonymous attendee asks, are there any reliable testing methods to identify potential developmental issues within sperm? So looking at quality, and I guess I would presume like the likelihood of a birth defect or something with the child.
Yeah, good question. So tricky to answer. So when it comes to sperm, you can, prior to creating an embryo, right? So if you're just talking about a semen sample, you can do DNA fragmentation testing, but I want to be clear as to what that does and what it tells us. So DNA fragmentation testing looks at the internal structures of DNA in a sperm. Now, sperm only have one purpose, and they can only do one thing, and that is to fertilize an egg and create a child, or embryo and then child, right? So they can do nothing else. Now, it doesn't tell us if your child will have a developmental or physical disability. It doesn't, DNA fragmentation can tell us a higher likelihood of difficulty conceiving because of more highly fragmented DNA. It can tell us higher likelihood of miscarriage or pregnancy loss because for the process of conception to occur, cells are dividing and multiplying multiple times over. They divide and multiply, divide and multiply. Then you get to blastocyst stage, then you get to embryo, and then eventually a fetus and a child is born. If DNA is too highly fragmented, that process cannot continue. So that's where pregnancy loss would occur. The only way to know a little bit more in depth about any sort of more specifics than in general speaking, you would need to have your embryos, so you'd have to fertilize an egg with the sperm and then have your embryos tested. There's genetic testing that can be done on embryos. You can also have genetic testing done, both partners could. It's not going to tell you a guarantee one way or the other, but it can tell you higher likelihoods of certain diseases or things you may not be aware of.
Phenomenal. One of these questions is just for us, asking about kind of what we have available in terms of our catalog for treatments for fertility that beyond just coming off of TRT. To answer that, primary ones would be FSH, HCG, and clomiphene. And then for kind of ancillary support, things like L-carnitine and inositol glutathione, reducing inflammatory burden, improving mitochondrial efficiency. There's a lot of interesting literature on L-carnitine and sperm motility and the mitochondrial health in sperm. So that's just a quick question there. But question for you, this one's also coming from me.
Yeah.
So you kind of, there's two camps that you kind of outlined in terms of guys going on TRT more so for vitality, for perceptual benefit in terms of how they feel day to day, versus, hey, this is an individual with clinical hypogonadism. We know that TRT is not a male contraceptive. It's very important to use protection, even if with the literature it does impact sperm, parameters, but people still do get pregnant on TRT. We've seen, physique athletes that are using copious amounts of androgens that are still getting their, significant others pregnant. I'm curious what your thoughts are, seeing that there's positive epigenetic benefits to, if you are kind of in that camp of clinically hypogonadal, coming into a more optimal range of testosterone. There's a lot of epigenetic benefits to that. Is there any case to be made for an individual staying on testosterone with ancillary medications for fertility so that they can pass that epigenetic benefit down to the child?
Yes, there's some caveats that come with it though. So, and thank you for pointing out, yes, testosterone is not birth control. If you do not want to get someone pregnant, you need to be using birth control, because you could do a test today on testosterone and go, oh, look, I have no sperm in my sample. That doesn't mean that it's forever that you'll have no sperm. Next month you might. So it's really important that you're taking precautions if you do not want to conceive. Now, the differences between people taking it for clinically low testosterone versus the vitality athletic performance, the difference is where you started. So for someone who started taking this because they have clinically low testosterone levels, they already probably have impaired sperm parameters. So there is a case to be made, I would say, to stay on these TRTs, but with ancillary supportive medications, not just to go on testosterone by itself. That's quite problematic. It's not 100%, and no one can tell you that it's 100% guaranteed, even with ancillary medical support, that you will always maintain your fertility. There is always someone that doesn't, and there is no way to predict if you're going to be the one or someone else is going to be the one, which is why we say it's a really good idea to freeze something just in case, or to continuously monitor, periodically every, you don't have to do it every 3 months, every 6 months is a little bit more reasonable to do this. But if you're trying to just make sure that, if you're trying to conceive naturally, if that's the plan, make sure there are still sperm present in your samples if you haven't frozen. But yeah, with those supportive medications, in some cases, and this is where it boils down to, you really need to talk to your prescriber. It's going to be based on your lab, what your labs look like, are you being well maintained at a certain level, how you're feeling. And then yes, in those cases, I would say it made sense to stay on, but it's different for everybody. So it's hard to say. Something that needs to be watched.
Can you elaborate on one thing you shared that, so guys on TRT, there's HBTA shutdown. He can do a test at one point and it says there's 0 sperm, and then 3 months later he could potentially, cause a pregnancy. Is there a mechanism for why is there a fluctuation that's happening, or what would be the mechanism there that one day, even without adding HCG or clomiphene into his protocol, one day he's azoospermic and then another day he's locked into something for 18 years and 9 months.
Yeah. Well, I want to also say that you don't go from azoospermic to having normal sperm counts sample to sample. There would never be that much of a swing. You might have some sperm seen in a sample. Now, first of all, user error. Okay. So, not the easiest thing to produce a sample into a very small specimen cup. It's quite easy to sort of miss at the very beginning, or to not get it all in there. That in and of itself would mean that the test wasn't as accurate. Most sperm are on the front end of the ejaculate, so at the very beginning. So if you were to miss any of the sample, you'd want to miss it on the back end, not the front end. So a lot of it can be user error. And people don't even realize that. They don't think anything of it. I've had more conversations with people who I'm looking at their results and they kind of aren't making sense. And I ask, do you have any trouble producing your sample? Oh yeah, like I was in the bathroom and half of it went in the toilet, half of it went in the cup. And I said, well, then like this isn't really an accurate result. So that's the first thing. Same thing with like the guy, and this is not even a joke. A guy spilled a sample on the kitchen counter, scooped it back in the cup. He's like, don't worry, I think I got it all back in though, so it should be good. I went, oh my God, this is not good. So once you eliminate all those things, it isn't just the hormone balances that would change it. It could be something like maybe you were sick, you had the flu, you had a fever for a bit. There are other things that could be going on in your life that could have impacted higher levels of stress. Oxidative stress has a hugely negative impact on sperm. Those could be the things that temporarily knocked your parameters down into very low or no sperm seen in one given sample, but that doesn't mean it would stay that way forever. Your stress levels may alleviate, or you're not going to be sick forever. Same thing for people who have surgeries. And I'm not talking about, surgery to the scrotum or testes. I'm talking about like you broke your leg or you sprained your ankle or, something else, you broke your thumb. Any type of injury, there's an inflammatory process that happens within your body just during healing. And so it doesn't have to be related to something in the groin or scrotal region at all that would temporarily negatively impact your sperm quality. Again, these are not things that are forever. So that's why it's a good idea to sort of monitor periodically, and then always use that backup birth control if you do not want children.
And then last question, super quick.
Yeah.
Any benefit for a man retaining semen prior to providing a sample? I know there's changes in volume, certainly, depending on the frequency of ejaculation, but should a man withhold for 3 days and then donate, or not donate, but yeah.
Produce, yeah. So no, there's been a lot of research done around the semen retention, and there was a big social trend going on for a while where everyone was saying, no, don't do it, try to withhold ejaculation. It is not good. It has the opposite effect. It is worse. You should be ejaculating regularly, always. For purposes of best quality sample, for testing or freezing purposes, the magic number is 3 to 4 days abstinence. That's going to give you the best balance of the highest level of concentration, the highest motility, and the highest volume. So the 3 to 4 day mark is the magic window for someone who's trying to either do an analysis to get a really accurate picture of where they stand, or that's going to be freezing. For purposes of conception, if you're trying to conceive, I have a whole nother intercourse pattern plan that I recommend that involves more frequent intercourse than that. So at the end of the day, you should not be withholding ejaculations. The longer you go, anything beyond the 5 day mark becomes what we would consider to be stagnant sperm or very poor quality. I've seen many times where people think they're doing themselves a favor, and I had one person who said, hey, my wife was out of town, then I was out of town, I managed to go a whole 30 days so I could have the best possible sample. His parameters were terrible. And I had to explain that if you would have just ejaculated once and then done a second sample, it would have been 10 times better. And I, in fact, had him repeat the test. It was significantly better. I said, you got to shorten that abstinence window. So you should not be withholding ejaculations. Off to the races for everyone. So.
One more real quick. Any other best practices before giving a sample? I know with our clients, when they're getting blood work done, we have a whole list of avoiding certain supplements, postponing your thyroid or testosterone or HRT dose until after the sample, but anything else beyond that?
No, you want to think of a semen sample like you would think about an A1C test, right? So when you're doing a semen analysis, it gives you an overview of what the last 3 months of your life have looked like, right? So there's nothing you can stop in the immediate. It's a little bit different with some blood work, but when it comes to semen analysis, there's nothing you could stop, shortly beforehand that would impact those results in any way that it would really sway things. I would say 3 months leading up to doing it is when you want to make sure you got your diet in check, you're getting good sleep, that your alcohol consumption is within what we would consider low limits, which is that less than 7 drinks a week. You maybe stop smoking, steer clear of any sort of recreational drugs, marijuana as well, whether we've seen such a huge uptick in marijuana consumption with the legalization in so many states, but it's been pretty heavily researched, and it is definitively showing that it has hugely negative impacts on sperm quality. So these are things you're going to want to stop many months before producing a sample, but in the immediate, no, just go ahead and produce your sample. That being said, with the caveat that if you've been very ill, if you just got over the flu, if you had something else major going on, it's probably a good idea to hold off and wait to produce that sample. Give yourself a few months. Sperm life cycle is about 74 days, 72 to 74, depending on who you ask. So really you need to go a full 3 months before you see a complete turnover of all the sperm in your body. They don't cycle all at once. Every day, new sperm are coming into maturation. Older ones are being a combination of reabsorbed by the body, expelled from the body. It's everything at once. And that's constantly happening. So 3 months.
Phenomenal. Well, thank you so much. This was incredibly informative. Everyone attending, I want to apologize and take ownership for the issues with the slides in the first couple minutes. Givelegacy.com/Merrick, correct? I dropped it in the chat. Yep.
Yeah, Sarah dropped it in the chat. Feel free to copy paste it. That is the landing page, but Merrick20 is the code. So if you, for whatever reason, don't save the landing page and can't find it, you can just go on to givelegacy.com. And when you place your order, you just have to remember to type in the discount code Merrick20 to get that 20% discount.
Phenomenal. Stephanie, thank you again so much. And
thank you all so much. Thanks for being here. Thanks for toughing it out, everyone. Have a great night.
Take care. Bye-bye.
Bye now.